This product is called Phyla, and it is a simple three-step system that is meant to be minimally formulated with maximum impact. Its simple twice daily routine starts with cleanse. So our cleanser is pH balanced and contains a number of gentle ingredients that can calm irritated skin. Its role is to prepare your skin to receive the phages. The second step contains our secret sauce. It's the black serum bottle, and it contains billions of live active phages. It delivers more than 100 million phages per dose, and it also includes salicylic acid, but only at 0.5%, not 2%. And we actually deliver it in an encapsulated form so that its orthogonal action does not interfere with phage action. Finally, we have the moisturizer because obviously a lot of people with acne have dry, damaged skin. It's a phage-friendly formulation, so it doesn't get in the way of phages acting. It contains 5% niacinamide, which is great for acne scarring and to heal hyperpigmentation due to acne. And it also contains other skin-friendly ingredients like squalane and ceramide that can hydrate the skin without being too heavy. Our products are cruelty-free and vegan, and we, shy away from harmful ingredients in our products. Now, obviously, as you're, hearing this, you're thinking, oh, I can get some quick wins with Phyla with inflammatory acne because so much of inflammatory acne is driven by C. acnes overgrowth. But I also want to highlight the fact that Phyla can be used with other medication, including Accutane and benzoyl peroxide, but it can also be used in non-inflammatory acne with, open and closed comedones, because that's when C. acnes overgrowth is just starting. And if you use Phyla as kind of a maintenance serum or a maintenance product, that can be quite beneficial. Dr. Akintilo, I mean, you've been using Phyla for a little while with your patients. Do you have any pearls to share with us?
Absolutely. So as Dr. Varma said, Phyla can be used on all kinds of acne. In my clinical experience, I do think the best entry point is for those patients with inflammatory acne, those big, tender, painful bumps. The patients who you typically would reach for oral antibiotics like the doxycycline, minocycline, sarecycline, maybe if someone's pregnant, erythromycin or clindamycin, perhaps. Those patients, this Phyla is, a shot out of the park. It's perfect. But as Dr. Varma was saying, it also is really good for long-term use as well, because not only do you really calm down the C. acnes, you regulate the microbiome, but it also helps prevent acne before it even starts. So it works as a prevention too. So I love it for my patients as a way to both quickly treat acne, right? The study was only 8 weeks and patients got, or subjects got better, but also it's a way to prevent acne in the long term. So it's safe to use for the long term, as opposed to many of the other medications like oral antibiotics that we use for our patients.
Great. Thanks, Dr. Akintilo. And, since we've launched, we've had over 50,000 customers. And what we've noticed is, although the clinical trial it recruited only subjects with mild to moderate acne, we are seeing great results even with moderate to severe acne, including chest acne, back acne. And because a lot of the inflammation here is driven by C. acnes overgrowth and other factors like hormones also affect C. acnes overgrowth, the fact that we are able to interrupt that cycle of inflammation is quite significant. And as we started launching this product over the last couple of years, we've had the benefit of working with some dermatologists to just understand, how do they treat acne patients? What are their patients saying to them? How does their practice work? And that's given us a great deal of feedback to learn how our product could fit into this practice and learn from them. And at the start of a lot of these conversations, they would say, oh, this is great technology, but how come I've never heard about this before? I knew about phages maybe from med school or from my textbooks or my training, but I wasn't aware that this technology was actually being used to build products. And so this is one of the many ways that we're trying to reach out and educate the providers and tell them, hey, there's a new tool in your toolbox. Although acne innovation has lagged the innovation of some other indications, that we actually do have something that's cutting edge and that reflects all the learnings that we've had in acne over the last few decades. Dr. Quintillo, I know you've got patients and you've had feedback from your patients regarding Phyla. Do you have anything to share with us?
I do, yes. So I would I would say number one, my patients who use Phyla love it. It's very easy to use, very easy to integrate into a skincare regimen. It can be easily plugged in either with the existing cleanser and moisturizer that's provided by the company as well, or with their own favorite cleanser and moisturizer as well. With social media, there's all these 12-step regimens that can be quite complicated. So it's really nice that with Phyla, it's very simple. It's just one serum you put on, and then you can immediately apply a moisturizer. It doesn't really cause irritation. The study showed there was one case of mild exfoliation that very quickly resolved, but patients really do very well with it. And another thing to highlight, you mentioned, or maybe I mentioned it briefly with pregnancy, but this product is great for pregnant patients. And as we all know, pregnant patients with acne are really a challenge because we're quite limited in what we can use. But Phyla is safe to use. So it's really nice that we have it for that reason. And, just quickly on a personal note, my younger brother had pretty bad inflammatory acne, which was challenging for him because he couldn't really tolerate oral antibiotics, definitely could not tolerate retinoids, and he's vegan to top it all off. So he had a hard time even finding over-the-counter products. But once he started using Phyla, actually very quickly, I think for him it was around week 4, within a month, he started to notice a decrease in his inflammatory lesions, and he loved that it's vegan, so it works well with his lifestyle. And he definitely feels more confident to say he's the brother of a dermatologist. So that's just one example of how great this line is.
Amazing. Thank you, Dr. Akintilo. And, to date, we've worked with more than 350 providers. They've had the opportunity of having Phyla in their hands, finding out for themselves how effective it can be, and then being glad that they have another tool in their toolbox so that when patients come in, they can offer them this alternative.